For any neck or shoulder pain, remember how important it is to release the muscles that attach into the sternum and into the shoulder. Importantly, of course, the subclavius underneath the clavicle, and then the pecs, pec major and pec minor. So we're just going to warm up the pecs a little bit before we go into the pec minor. So I have his arm up, and that's the lateral border of his pec major. I'm just going to draw a line right along that border. Then I'm just going to place my hand or your thumb, whichever works better for you. Right now I'm going to use my thumb. I'm going to place it right underneath the pec minor, and I'm just going to have Hank try to pull his elbow towards his nose. Go ahead, good, good, good. And relax. Any discomfort with that?
No.
Okay. And as he is pulling the elbow towards his nose, he is activating the fibers, and then when he pulls his elbow back, we're stretching him out. And again, pull towards your nose. Good. And relax. And stretch it out. When we come into the subclavius, I'm just going to place my fingers right underneath the clavicle and just drag from medial to lateral to really reduce the tension in the subclavius muscle. And you can drag it all the way out to the lateral arm. Now I'm just going to lower his arm down and get under or above the clavicle, rather, into the attachments of the SCM, the distal attachments, and the scalene. Just want to place my finger as deep as it will go, do some frictioning right above that border, and then just lower the arm down and stretch it back as you strip right over that border. Of course, we want to be careful that we don't cause any radiating pain or sharp shooting pain. That usually indicates that we're on a nerve. So just check in with your client, see if they're comfortable. If you may find some trigger points in here, so if that's the case, just do direct compression and then pin and stretch them out. This is an excellent position to get deep into the anterior scalenes. So I'm just going to find the SCM first, place the side of your index finger right in front of the SCM, tilt your head down a little bit to shorten those muscles. When he does that, I slide right into those anterior scalenes and I start to friction. And then tilt your head back. Good. Just stretch them out a little bit. And again, I'm going to tilt forward. How's that pressure feel to you?
It's okay.
A little bit uncomfortable, maybe?
A little tender.
A little tender. Any trigger points?
No.
Excellent. It's a great way to get into those anterior scalenes, reduce those trigger points, reduce any entrapment they may have causing pain down the arm, or especially weakness down the arm, such as a thoracic outlet syndrome. And then we're going to we showed in the neck video, we showed some home care for the SCM and for the scalenes.